Podcast is now starting. All attendees are in listen-only mode.
Hello and welcome to the CFN webinar for November the 27th. Today we have Dr. Paul Stolee and Dr. Jacobi Elliott come in to talk to us about developing patient-provider partnerships across the system. My name is Amanda Lorbergs. I will be host of today's webinar. And as usual, we will answer as many questions as time permits, but only at the end of the webinar. However, feel free to use the chat box and send in your questions throughout the webinar, as you don't need to wait until the end. We'll just wait till the end to address them. After the webinar, you'll have a survey pop up on your screen. Please let us know how we're doing, what we can do better. And as per usual, the slides and video content will be available on our website within a day or two. We have a couple of webinars coming up. So the next one is next Wednesday, December the 4th, at the same time, noon. And we'll have Kelly Stajahar coming in to talk to us about integrated approach to palliative care in acute care. And then we'll kick off 2020 with a webinar on January 15th with Rachel Cataroo and Amritpal Bular, and they'll be talking about elder-friendly approaches to the surgical environment using biological samples to identify and provide optimized care. So keep those in your schedule. CFN news, the only news is just to make sure that the application packages for the 2020 Interdisciplinary Fellowship and Summer Student Awards, those applications are due by December 16th at noon. So keep working on those, and deadline is approaching in a few weeks. If you need more details, you can visit our website. And now I will introduce our presenters for today. So we have Dr. Paul Stolee, who is professor in the School of Public Health and Health Systems at the University of Waterloo. He also leads the Geriatric Health Systems Research Group and is the director of the University of Waterloo Network for Aging Research. He's joined by Dr. Jacobi Elliott, who has adjunct appointments at the University of Waterloo and Western University, and is the evaluation lead in specialized geriatric services at St. Joseph's Healthcare London. So welcome, Paul and Jacobi. We're going to hand it over to you now, and you can go ahead with your slides.
Okay, well, thank you very much, Amanda. I'm hoping that you can see our slides by now.
We can see your slides, but you are in, could you go in slideshow mode? Because we can just see your presentation mode right now.
Okay, so how do I, is that in display settings?
Yes, display. I'm trying to see. I think you may, is that it? The top one, I think. Like, I'm having trouble.
Okay,
there you go. That looks good.
Okay, so you should see a slide and no incriminating notes or other information. Is that right?
Yeah, we're all set.
Okay. Okay, good. Well, thank you very much, Amanda, for that introduction, and thanks CFN for giving us the opportunity to share some of our work with you today. The outline for our presentation is that we are going to first give a bit of background on some previous work we did related to engagement, including a literature review for CFN and some of our own experiences. Then I'm going to turn it over to Dr. Elliott, who's going to go over the more recent project that we did to better understand patient-provider partnerships, including some interviews and a group consultation, and then some of the next steps that we're involved in as part of this work. So I don't think this group today would need a lot of convincing that patient and family engagement is a good thing to do. We know from research and from lived experience of patients, caregivers, and care providers that stronger patient and family engagement can outcomes improve patient experience, and result in better care plans. Patient and family engagement is importantly aligned with the elements of patient-centered care. So these would include respecting the dignity of the person, really listening to the patient and family to get their perspective, information sharing effectively between providers, patients, and families, meaningful participation in decision-making, and strong collaborations of patients, families, and providers in making decisions about care. There are a lot of definitions of patient and family engagement. One that we like at the moment comes from the World Health Organization that says that all of these definitions share an underlying theme, the facilitation and strengthening of the role of those using services as co-producers of health and healthcare policy and practice. And we like that definition because it points to the importance of having all of these partners involved in the process of healthcare planning, of research, and of clinical decision-making in order to ensure the best possible result. So I'm going to go over briefly some work that we did for CFN back when it wasn't even called CFN, in a knowledge synthesis grant. And I think it's noteworthy that this was 2013. So this was very early on, I think, in CFN's work in Canada, and I think speaks to the long-standing commitment that the Canadian Frailty Network has had in supporting work that furthers stronger patient, family, and citizen engagement in healthcare and in healthcare planning. So this project was a knowledge synthesis. We looked at over 15,000 articles. We looked at the gray literature. We did all this in partnership with Patients Canada and the Canadian Foundation for Healthcare Improvement. And this resulted in a framework and guidelines, one related to research and planning, and the second related to clinical decision-making. So this, from this work, we put forward a framework that can present a way to think about engagement in clinical decision-making. And one of the features of this, as you can see here, it's a dynamic model that involves the close or important involvement of patients, of providers, and of the social support system or caregivers, and the interaction of all of those groups. So understanding the patient needs to be central to that process, understanding their characteristics, what their skills are, their knowledge and goals, understanding what the families need and what they know and can contribute to the care planning process. Of course, family caregivers are particularly important for older adults who may require the support of another person. And a key point is the strong relationship that needs to be developed and maintained among patients, families, and providers that's built on trust, respect, and open and honest communication. This work was published in a couple of papers. There is also an additional manuscript that discusses engagement in research and healthcare planning. Some of the key findings from this literature synthesis was that healthcare providers and older adults should discuss how the person would like to be engaged in given situations. And I think an important aspect of that is that engagement is not a hierarchy where you need to move a patient up the levels of engagement from lower to higher engagement. This is a choice, and the level of engagement would depend on the older adult's preferences and expectations, as well as the situation that you happen to be in a particular occasion. But also the importance then of understanding the older adults and caregivers' preferences, goals, needs, and expectations, and the maintenance of strong communication to continue to foster an open, honest, and trusting relationship. So in an engaged partnership, patients should know they have a right to engage in shared decision-making, that this is an option that they have, and healthcare providers need to make it clear that they have a role to play if they wish in making decisions about their care. The context, again, is important. Different levels of engagement may be appropriate for different situations. So obviously a long-term relationship in a primary care clinic would suggest certain types of engagement are possible and meaningful. A critical situation in an emergency room, it would be a different story. But this level of engagement should be continuously evaluated. The level is going to evolve and change over time. Also, the partners involved are going to gain knowledge, skills, and experiences in engagement and in understanding the other partners in this process. Now, that project was a few years ago. Now, interestingly, a couple weeks ago, our group was involved in a local regional session involving health system stakeholders from across our region. And we took this opportunity to ask the stakeholders in that room, what 3 words come to mind when you think about patient engagement? And for fun, we're going to put up this word cloud that shows what some of the results of that were. So interestingly, communication, clearly important, listening, empathy, collaboration, involvement, compassion, kindness, choice. So I think what this word cloud illustrates is that this is a very rich and meaningful concept for health system stakeholders, even though they may interpret it in some respects with different gradations or different meanings. It's a very important concept, and some things come through particularly strongly. The importance of communication, close involvement and collaboration, and working together compassionately and with empathy. So our work on patient and family engagement, I think in some respects dates back to work we had done some years ago, trying to understand the care transition experiences of older adults and caregivers in a project where we interviewed patients, caregivers, and healthcare providers at transition points as they moved across the system from acute care to home care to long-term care and so forth. And what we found in that project was that, unfortunately, but not surprisingly, older adults are often not involved to a great extent in decisions that are important for their care. Family caregivers are often left out of the equation altogether, even though they have very important information to share and their views are critically important. So we took those learnings to heart, and that led us in some respects to the work we've just described and we'll be describing going forward. But it also, I think, told us that we needed to do better ourselves in our own work in working in partnership with older adults. So we started a group that was called Seniors Helping as Research Partners. This was started with with an older adult group. We have about 60 members of this group. We meet monthly. And the important thing to note here is this is a partnership group. So we are working with older adults as partners in all of our research projects in which they can share their experiences, they can share their perspectives and insights onto our research questions, our projects, and help us interpret our findings. And they've helped us also with our knowledge translation activities. And here you see Dr. Elliott and some members of the group getting an award for this work. So now I'm going to turn it over to Dr. Elliott, who is going to continue on talking about the project that we've done more recently.
Great, thank you. So I'll speak specifically about the methods and the results related to our patient-provider partnership grant. So after completing the literature review that Dr. Stolee just shared, we really wanted to see what clinical decision-making engagement looks like in practice, what was actually happening on the ground. So we set out to explore what current practices of engagement look like, what factors facilitated or hindered the development of meaningful relationships between the patients, families, and providers. And we also wanted to know how our newly developed framework that was just shared, how that framework that evolved from the literature aligned with current practices. And lastly, if we learned that there was an opportunity or a need for education on engagement, we really wanted to know what materials or resources could be created and how they should be distributed to both older adults and healthcare providers. This was a qualitative study where we conducted in-depth interviews with older adults and healthcare providers. We conducted 14 individual interviews with older adults and 10 individual interviews with healthcare providers, which included nurses, physicians, nurse practitioners, and allied health. We also had the opportunity to do a larger stakeholder consultation with 120 healthcare providers and 5 older adults. Participants were sitting in groups of 8, and we were able to gather written feedback from these groups. The individual interview data was audio recorded and transcribed, and all of the data were analyzed using emergent coding and directed coding techniques. Specifically, the choice framework that was just presented was used to guide the directed coding. So first, I'll highlight some of the findings that emerged from the older adult interviews. There were a number of high-level themes, such as communication, patient-centered care, education, and partnerships. Communication came through as a common theme among all of the older adult interviews. Older adults provided some positive examples of communication, such as when healthcare providers are really taking the time to listen to their concerns, or when providers call the patients at home to check in and see how they're doing, or when providers take time to provide information guides that really help to communicate the health information to the patient and family. One older adult said, "My doctor is very good at two-sided conversations. Usually we sit down, we talk about it, I give her my feelings, and she works with them." However, many older adults also shared a number of situations in which communication with providers was poorly executed. For example, there was a lack of information exchange at points of discharge, so people were left not knowing what was happening next or were not included in discharge conversations. As well, older adults spoke about the use of jargon and complex terminology that left them really confused. They stated that they frequently had to search terms on the computer to understand the information that was given to them. Older adults highlighted the need for more knowledge on how to communicate effectively with healthcare providers. Surprisingly, many participants also acknowledged that they actually really didn't know that they have choices when making decisions about their care. They didn't know they should be contributing to these discussions, with one older adult saying, "Inform us that we have choices." Older adults also said they were afraid to speak up, so it's important for professionals to create a welcoming environment. And lastly, they also said they really need to learn to be self-advocates to get the care they want and need. with one patient saying, "I'm constantly having to fight and be really vocal and really stand up, and it worries me that a lot of people can't do this." Through the interviews, we uncovered a number of points as it relates to engagement practices from the perspectives of older adults. We don't have time to go through everything on the slide here, but I did want to highlight a few key points. In our discussions with older adults, it became clear that the current healthcare system can actually act as a barrier to creating meaningful partnerships. So barriers included limited staff resources, uneven power dynamics between patients and providers, and limited time during clinic appointments to have meaningful conversations. After some self-reflection, older adults also discussed a number of barriers that maybe they could have some control over changing. So some of those barriers might include, not having the skills to speak up and advocate for themselves, or not being proactive about bringing a friend or family caregiver to listen in and take notes during appointments. We uncovered a number of facilitators for meaningful engagement. So when older adults had positive examples of engagement, we really wanted to dig a bit deeper and understand, why was that situation or experience so positive? What made it so positive? So some of the facilitators included older adults educating themselves so they could participate in conversations, respectful and open dialogue with providers, and an integrated health system where all providers in the circle of care were up to date on the care plan and really understood the patient goals and wishes. Next, I'll present some of the findings from healthcare providers. So again, a number of high-level themes emerged, such as rapport and relationship building, communication, and educational needs. So although not surprising, the theme of time emerged in all of the interviews. Providers said that meaningful engagement takes time, so they acknowledge that, but it's time that they don't necessarily have in the clinical care setting. Providers acknowledge that for successful engagement, building a relationship is extremely important. And although it takes time, many providers did recognize that it can greatly improve care and engagement. So providers did provide some ways that they are currently building relationships, including face-to-face visits. They felt that was very important. Some providers also talked about tracking personal and social information about the patient in the electronic medical record so that they could continue to learn more about the patient. And people talked about really just allowing time for the relationship to develop. One nurse said, sometimes it takes a few visits before the patient is willing to open up. So again, just really acknowledging that it takes time to build strong relationships. Providers also talked about developing trust with the patients and how important that was for the relationship. Of course, communication emerged as a common theme here. Providers emphasized some techniques that support good communication, including providing patients with both written and verbal information, allowing patients the time to ask questions where possible, and trying to maintain eye contact with patients and families rather than looking at the computer screen. Interestingly, we also heard this from patients as well. When providers were not making eye contact, they really did feel disengaged. One physician, this is an interesting point that I wanted to highlight. One physician highlighted that as you build a long-standing relationship with patients, you do need to be mindful that you're still checking in and continuously asking questions. He reflected on an example where he thought he had a really good relationship with a patient, and he just made the assumption that the patient would be comfortable coming to him with concerns. But actually, as a result of the strong relationship, the patient was embarrassed to raise some of the concerns for fear that he would let down the physician. So I think it's just a really good reminder to be continuously asking questions, checking in, and really evaluate that level of engagement with the patient. Again, we were able to identify a number of factors that facilitate or hinder engagement from our interviews with providers. So similarly to those highlighted from the perspective of patients, barriers to engagement included time constraints, limited resources, and a lack of understanding of patient circumstances. Facilitators to engagement included respectful communication, gaining trust, equal power dynamics, and really encouraging patients to educate themselves and be advocates for their own care. Lastly, we wanted to highlight some of the findings that emerged related to overall system coordination. We saw with our choice framework, we need to recognize that the patients and families move through the healthcare system and come in contact with different care providers. And I think this is especially important for those complex older adults. So to support engagement across the system, we need to ensure correct information is being transferred to other care providers, and that the patient and family goals and wishes are constantly being considered as the patient's moving through the system. So we had the opportunity to gather information from 120 healthcare providers during a one-day event a couple of years ago. Every year in our region, healthcare providers working in the geriatric system gather for an education day that usually involves some sort of roundtable work. So participants span a number of different organizations and positions, including providers from primary care, home care, hospital, long-term care, and roles include nursing, allied health, and management positions. So we took this opportunity to provide participants with case scenarios and a work package, asking how providers were currently engaging with older adults, what resources would be needed to support engagement, and how providers would like to receive this information. So to share some of those findings. So on the screen, you can see the question that we asked and the responses. We asked how healthcare providers were currently engaging patients in care planning. So some of the responses included care conferences, just asking patients what they want, and trying to involve family when family is available. However, many of the responses that were on the forms we received back related to this question, many people wrote that they needed and wanted more information about how to engage older adults in care planning, and that time was an issue. So it was recognized that new processes are needed to facilitate engagement. We also asked participants about educational materials. So participants did highlight the need for information guides that they could hand out to patients and families. Providers also talked about really wanting more education on specific strategies that they could implement to enhance engagement. And it was highlighted that more education for patients would be helpful, maybe something that could highlight some key questions that they could ask to help guide conversations. Since participants identified more education was needed on how to engage patients and families in decision-making, we asked how people would like to receive this information, and some of the top responses included one-day workshops and interactive sessions. Others said e-learning would be okay, but much preferred that face-to-face interaction. So after analyzing all of the information from our individual interviews and the group event, we were able to map the findings onto our choice framework that emerged from our realist review that was presented earlier. Providers really need to understand the whole patient, their goals and wishes. One patient said, they forget there is more to the patient than the leg. They need to learn about the mind, the fears, and the wishes. Providers also need to consider the family caregiver's role and how that family fits into the person's life and care journey. And lastly, providers acknowledge the need for more education, with one provider saying, what does engagement really even mean? As the results showed, it's important to consider engagement across the health system as people are moving between health sectors and different groups of providers. So in summary, healthcare providers and patients need to build trusting relationships so patients feel comfortable participating in decision-making. And I think what's really important is that patients really need to know that they have a right to participate in these discussions. We know that meaningful engagement takes time, which is not always supported by our healthcare system, but there are some techniques that could facilitate engagement, even with the limited time during clinic appointments. And lastly, both patients and providers said they need more education around engagement practices. Patients want easy to understand resources, and providers want those interactive face-to-face learning opportunities. So based on these findings, we have been working with our SHARP group and other stakeholders to develop some educational materials for both patients and providers. When we talked to older adults and providers, they recommended a range of educational materials such as advertising and flyers, and local papers, tear-off sheets that could be available at places like libraries or pharmacies, pamphlets in the doctor's offices with messages such as, here are things to ask your provider, or here are sentence starters to engage in conversation. So on the screen here, I've displayed a few examples of resources that are in development and being tested with our older adults. But regardless of the format or the end result, older adults reminded us that we need to use large fonts and keep it really simple so that it is easily understood by everyone. And here are some examples of materials that are in development for providers. I did want to share this link to the video on the screen here. This is a video series that we learned about from the UK that's used internationally for educating providers on engagement. We have also created in-person training and online training as part of a larger project, which I will speak about in a minute. So we're really trying to cover the different methods of knowledge dissemination to support in education for providers. And so far, we've had some positive responses to these different materials. So our next steps include continuing to work with SHARP and our study sites to refine materials as we test them in practice. We are using some of these materials in our CFN transformative grant titled Transforming Primary Care for Older Canadians Living with Frailty. So through this project, we will collect information about implementation of the resources, the use of the resources, and outcomes as it relates to patient and provider experiences. So just a little bit more information on that transformative grant. We have 9 primary care sites across Canada, and we are using the knowledge and content from this Catalyst grant to inform the resources that we are implementing in practice and testing. And specifically, I wanted to highlight the work by Dr. Anit Gajer at Laval, who has created decision aids for older adults to really support engagement and decision-making in clinical practice. And I'll just finish by, again, thanking CFN for this opportunity, and a special thank you to our SHARP members for their continuous partnership in our research. That's it.
Great, thank you very much. Great presentation. So as everyone is thinking about their questions and submitting them, I'll just get us started off a little. So the time kept coming up as an issue, especially in primary care with the 10-minute appointments. How do you think we can overcome this so that patients and family caregivers can be more engaged in the decision making?
Great question. So I'll just share maybe a key learning or example from our primary care project that's ongoing right now. I think it's helpful to recognize that the conversation doesn't have to happen all in one appointment, all in that first 10-minute appointment. So rather, starting the conversation, giving the older adults information that they can take home and digest, and then book a follow-up appointment where they could come back and participate in maybe a longer conversation where the older adult has had time to do some research on their own and come back to ready to participate in that discussion.
Yeah, I could add to that. I think time was certainly an issue that was raised, particularly by healthcare providers. But I think what our work also showed was a great interest on the part of providers as well as patients and families to be more meaningfully engaged in decision-making with patients and families to what extent. So I think that there's a willingness there to try to embrace this challenge and to look at how things can be done differently.
And I'll just add one more point. I think what we've also recognized we're working in team-based primary care centers. And I think it's important to look to other clinicians in the team-based setting that might have the ability to have longer appointments. So we know that maybe physician time is sort of capped at 10-15 minutes, but maybe turning to a nurse practitioner or social worker that can book longer appointments to really have those in-depth conversations with more complex patients could also be another strategy. Maybe not always feasible, but definitely an option.
Yeah, that's an excellent point. Usually there is a larger team that can help out with that. And the next question, could you talk a little bit about the older adult sample you interviewed about?
Sure, yes. So the older adults included in the study had complex conditions, were over the age of 65, and we purposely sampled from urban and rural locations. We did have a number of family caregivers that participated in interviews as well, and actually many of the interviews happened over the phone. That was just more convenient for the older adults.
Great. I know it's always hard to, find these representative groups of older adults. Where did you recruit from, or what was your recruitment strategy like for that study?
Good question. So we really used kind of our key stakeholders in the region, so gatekeepers that asked patients if they would be willing to speak to us. So we used nurses at family health teams. We used case coordinators in home care. So we used a variety of different methods, but really leaned on our healthcare provider stakeholders to assist.
Great. And what about something like, if you could choose one key message that really stood out to you during these interviews, what would you say that was?
Well, one point I think was the one I made in response to the earlier question, that engagement is something that I think there is a strong will and a commitment on the part of patients, caregivers, and providers to take on as a challenge, despite some of the obstacles to doing that.
Yeah, I think maybe I'll highlight two. I think what was really surprising, and maybe not a key message, just surprising, was that many older adults talked about not knowing that they had the kind of opportunity or option to participate in decision making, that usually clinicians sort of made the decision and told them what to do. So I think being mindful of that and continually telling older adults or giving older adults the opportunity to participate in those decision makings is really important. I think one key learning as well, when we spoke to older adults who sort of had one point of contact in the system, so had that case coordinator or that social worker that they continually reported to regardless of how they were moving through the system, they seem to have better experiences with engagement, and I think it is due to building that strong relationship with one key kind of system navigator that they relied on.
And maybe as a fourth of our one single key message, I might add, I think through this work and through some of our other work, what I think comes through as a very strong theme is the importance of establishing a relationship of trust among those involved. And I think that is necessary, I think, so that all parties involved are going to be willing to share things that are important to them, things that you wouldn't necessarily bring up in a casual conversation, a casual, how are you today kind of conversation, but the things that are much more important and meaningful that people might need to share in order to produce the best possible care plan.
Yeah, that's great. And I think that's really, it sounds like that's where the KT tools would really come in handy, is to sort of stimulate those conversations that wouldn't typically come up in just a quick hello and, a general question to the patient. So I don't see any more questions coming in, but perhaps you have some closing thoughts or anything to, it looks like we'll end a little early, but if you have anything you'd like to add. Oh, hold on. We do have something that just popped up. We have a comment saying, wonderful work. I wonder how this work could link to the Regional Geriatric Program of Ontario's Seniors Friendly Care Learning Series, which focuses on 7 key clinical topics and includes healthcare provider education modules, as well as awareness posters and patient handouts that can be used by healthcare providers to initiate conversation and be used to reinforce conversations. There are resources at the RGP Toronto website, but maybe you can comment on your awareness, or how you might fit into this program, or if you had thought about it.
Yeah, thanks for that comment. So I think our work closely aligns with the Senior Friendly 7 topics and the tools that have already been created by RGP Toronto. So I think there's guides for providers, but they've also newly developed guides for caregivers. And if I'm not mistaken, there's key questions that caregivers can ask providers around the different topics. So key questions for delirium or nutrition or pain. And again, I think those are just examples of giving caregivers and patients the tools and the power to ask questions and just giving them sort of those conversation starters, which is exactly what we found from this work, that's what people were asking for, just give us those key questions to ask and give us some knowledge and information on healthcare topics so that we can feel, like we're in a position to actually contribute to the conversation and to the discussion with providers. So yeah, I think they closely align with that work.
That's great. Yeah, that's a good point. Sometimes I think people go into the office and for their appointments and just forget, what kind of questions they probably had, a week or two before. So it's good to have that. Okay, so if either Paul or Jacobi, do you have either of you have closing thoughts you want to leave us with, or any words of wisdom as we all go and try and engage older adults as patients, citizens in our research?
Well, I would just say again that we are very appreciative of the support that CFN has provided us to do this work, as well as the other important work that CFN is doing to advance patient and citizen engagement related to persons living with frailty. So I think they've recognized it as a priority and has been something that we've been focusing on in our own work.
Yeah, and I'll just carry on with that comment. I think, our presentation today was on engagement in clinical decision making, but I think all of us on the webinar today can think about how we can engage patients and families in our own research and in future health system planning to ensure we're creating the best health system for older adults.
Great. Well, thank you very much. We appreciate all the work you're doing. So we will let everyone off early, and thanks again for joining us.
Thank you.
Thank you.
Okay, bye-bye.